Hi, I'm Ben Ponder, and I want to talk with you for a little bit today about healthcare. And I'm going to do it in a few different segments, and so bear with me. We'll try to break it up into bite-sized videos. I want to start first off with this particular and very personal setting of the stage, and that's I'm so hard on insurance companies because, like many Americans, insurance companies have been hard on me and on my family. And I thought the best way to relate this to you is kind of by telling the story of our own healthcare journey, specifically through the lens of the 4 kids that we have and the 4 childbirths and the different experiences that we had and how health insurance played into those. So first of all, Amy, my wife, and I have had, I think, just about every kind of health care or health coverage imaginable. We've had corporate insurance, we've had group insurance, we've had private insurance, we've had a Christian sharing plan that was kind of a quasi-insurance, we've had no insurance, and we've even had Canadian insurance. We lived in Canada for a year as a young married couple. And so we've had a taste of the breadth of options available to most Americans. So, like I said, we have 4 kids. Our first daughter, Ava, was born in Fayetteville, and then we had another daughter, Elise, born in Chicago, and our 2 sons were both born in Mountain Home. Ava, when she was born, had to be placed in infant intensive care for several hours, and at the time we had student health insurance through the University of Arkansas. I was making about $7,000 a year, and we were scraping by on my income as a graduate teaching assistant. We found ourselves, Amy and I did, begging and pleading and arguing with the insurance company after the birth, after our daughter came home and was healthy, just to get Ava's treatment covered. And we found back then that after, I think, probably a dozen phone calls and stonewalling and confusing language and all the tactics that insurance companies take, I remember turning to Amy and saying, you know, the house always wins, but the way they win is by wearing the little people like us down. And they're just going to stall, and they're going to stonewall us, and they're going to refuse to cover us, hoping that we'll throw our hands up and either get frustrated or just dejected, and we'll quit, and then they'll win. And so our commitment is, we're not going to quit. And we didn't, and by golly, we got payment for that, but we worked really hard for it. So, you know, it was in that early point in our marriage even, and in our family life, that we realized that insurance companies make their money by not paying on claims rather than by actually covering patients. And around that time we also realized that pregnancy in insurance jargon was considered a disease, a pre-existing condition, something we thought was rather unique to the insurance industry. Our second daughter, Elise, was born outside of Chicago, again while I was a graduate student there. And we were partially covered at the time and then partially self-pay. And it was a very interesting experience because we were really treated like cattle in a clinic in the basement of the rich people's hospital. And it was during that time that Amy and I first really tasted the way that lower income families in our healthcare system are treated as subhuman. And we faced it. We went through the bureaucratic mess. We went through the degrading comments from healthcare workers, and it was an eye-opening experience for us again. Our third child, Lincoln, we were, and this is just sort of I guess a something about us. We were never very good at planning our pregnancies, and so with our third child, we found ourselves caught between insurances. So we had that pre-existing condition, that disease of pregnancy, as the insurance companies considered it, and so my wife Amy visited her OB-GYN, and when they found out that we were private pay, they immediately ushered her off to the office manager's office. And Amy told me later that she felt like she'd been called into the principal's office, that she was in trouble for something. And it turns out that the office manager told her that she'd have to pay, if she was going to be private pay, then she'd have to pay for everything up front, which I think would amount to somewhere over $3,000 at the time, before she could even be seen once by the doctor. And that, of course, didn't include the hospital bill, that if everything had gone smoothly and perfectly, would have been upwards of $5,000 or more. Now, Amy is a penny pincher, and so she thought really long and hard about those figures, and in the end decided, with my support, to give birth at home with a midwife. And so thankfully everything went great there, and the whole thing ended up costing us, I think, just about $800, which was a lot better than $8,000 plus. With our fourth child, our newest son, Whit, we had quote-unquote good insurance, subsidized by my former company. And it's the kind of insurance that a lot of people who are really upset with healthcare reform have. It's decent co-pays, decent prescription coverage, 80% coverage of most events. Still costs a lot. I mean, the premiums, even when subsidized by your employer partially, are pretty hefty. And then on top of that, 20% of a major medical bill is still a tough pill to swallow. But the key difference there is that you don't live in fear that one wrong turn, one bad break, and you're going to end up in bankruptcy. And I think that fear is a factor that some folks who have only had the more traditional models of coverage don't quite understand. And so finally, on this kind of personal note, even now after I left my former job managing the pharmacies, our family's on COBRA, and so to cover a family of 6 on COBRA, the plan, it's a decent plan, but it costs just about $1,000 a month, which, if you really stop and think about it, around the First District, that's a mortgage on a really nice house in most parts of the First District. And that's not guaranteeing that everything is paid for. There are other costs in addition to it, and these are serious issues for everybody. These are when it starts to affect your wallet, your pocketbook, and the livelihood of yourself and your family, the long-term prospects of your family, then none of these health-related issues can or should be taken lightly. And so as I continue to talk about healthcare reform and our healthcare system, I want you all to know that I've walked a mile in a lot of people's shoes in this regard, and I take the situation personally and very seriously.